The second story. Last week we heard from our Supreme Court judges. Yes, the country of Rwanda in Africa is unsafe. It's an unsafe country. OK, that's their judgment. Well, it may be. I don't know. I've never been there. But it turns out, according to a report from The Economist called The Economist Global Health Index, that the same country, Rwanda, is substantially better than the United Kingdom for seeing a GP. You couldn't make it up, really, could you? It's easier to see a GP in the unsafe country of Rwanda in Africa than here in the UK. In fact, Britain is the third worst place in the world to see a GP in either 24 hours or 7 days to see a family doctor. I suspect many of you are not surprised by that finding. Well, let's speak to my next guest down the line, Dr. Lawrence Buckman, who's a former GP and also the BMA UK GPs Committee Chair. Lawrence, thank you so much indeed for being with us. You may have seen this report from The Economist, from their Global Health Index. Were you surprised by, that pretty stark comparison between a developing nation, Rwanda in Africa, that apparently is unsafe to go to, but if you get there, the good news is you can see a GP within a day. Not much chance here in the UK. What do you think to this?
I'm not surprised at all. I predicted it 20, 25 years ago. It was obvious it was going to happen, and it has. And I'm not pleased to be one of the many people who said I told them so. And we're now in the health service chaos that was obviously going to come.
And I guess, Lawrence, it's not surprising. You talked about it 15, 20 years ago. But if you allow a population of a nation to increase by 10 million, then surely you've got to plan for all the related impacts of that, whether it's housing, whether it's hospital beds, whether it's doctors, whether it's dentists. It doesn't seem to me to be rocket science.
No, but it equally isn't rocket science to know that when the numbers of working GPs is going to plummet in the future, which is now, in fact, it was about 5 years ago it plummeted, then when the numbers plummeted, the number of patients, even if there's no change in the population size, the number of patients who couldn't get access in a reasonable time frame was inevitably going to rocket. And that's what's happened. I don't think any GPs are proud of this, by the way.
No, I'm sure not, apart from anything else, because, of course, there's a massive increase in the pressure of work for GPs. So the data I've got here, Lawrence, for England, there's 7.8 GPs per 10,000 of population. The OECD average is 10.8. So we're about 25 to 30% down on the OECD average. Does that strike you as being about right from your experience?
I think it's worse than that. The reason it's worse is because a lot of GPs don't work full-time anymore. I'm the last dinosaur generation that saw patients across the entire working week. Now GPs can't work at that pace, and I understand why. And I would suspect that those numbers are not completely accurate. They're probably measuring number of humans rather than whole-time equivalents. So the number of doctors who work part-time has risen enormously over the last 20 years, and partly because they can't cope with working a 10-session week, plus weekends and out of hours.
So there's data that suggests that we need some 16,000 more GPs. That's about a 44% increase. How are we going to find those GPs, Lawrence? Maybe actually we should do like a reverse Rwanda treaty, and instead of sending illegal migrants to Rwanda, maybe we should go to Rwanda and ask them if we can borrow some doctors for about 5 years.
Well, we've been doing that for quite a long time. We've been raiding the old Commonwealth and the new Commonwealth for doctors. But of course, they need them too. They're not very keen on seeing all their doctors run away. And even though doctors do come to this country, we have a lot of doctors come in temporarily. But the fact is, there's nowhere near enough. And I'm sorry to say that we had a big supply from the European Union, large supply, particularly from Holland, Denmark and Germany. And that's gone. So we've got a supply of doctors no longer there. And We can raid other countries to get more doctors, but it's not going to solve 16,000 extra doctors. You can't
No,
do
but
it.
so Lawrence, why is the government persisting with, as I understand, they've still got a cap on training places for UK-based graduates, students who want to train in medicine to become a GP, hopefully, and there's still a cap on those places. That's right, isn't it?
It is. It's mysterious. I'm sure it has something to do with money, I would guess. But it isn't anything to do with need, because we clearly need an enormous expansion. 44% expansion, that sounds about right. Well, you're not going to get that without the 10-year time it takes to grow GPs or to grow other healthcare workers. We need doctors, nurses, all the other people. We don't run our plant 24 hours a day because we haven't got the staff to man it. We could be running scanners 24 hours a day if we had enough radiographers. We don't have any of those things in place. We've let it happen, and now we're staring at I was told I was a shroud waver at the turn of the century, and now, what a surprise, it's all going wrong.
Well, there's a lot to be done. Lawrence, thank you so much indeed for joining me. That's Dr. Lawrence Buckman, former GP and BMA UK GPs Committee Chair.